Well, thank you very much, Chairman Alexander. Good to be here today with you. And I also want to thank our committee staff who helped us set up this technology to make this hearing possible. And of course, thank you to our witnesses for being here today as well. Our committee's last hearing on COVID-19 was March 3rd. And during that hearing, I expressed my intense frustration at the administration's lack of preparedness, its failure to ramp up testing, the White House's constant contradictions of public health experts' guidance, and more. Now we are more than 60 days later. I wish I could say I had better things to say about the administration's response, but I do not. The only difference is that now over 800 people in my home state have died. Nationwide, now more than 73,000 are dead, and tens of millions are unemployed. Meanwhile, the president is still denying the severity of this crisis. He is still insisting it is not his problem, and he is increasingly attempting to control and silence those who want the truth to be told. The president is afraid of the truth because here it is. He failed and continues to fail to protect lives and our economy and our way of life. And that brings me to our witnesses today. I appreciate you being here, and I expect you to tell the truth today. I will want to know your honest assessment of where we stand on testing capacity and whether we are preparing appropriately to have a safe, effective vaccine as soon as possible. I will want to understand how you're planning to prioritize public health over political influence and corporate profits. And I will want your commitment that you will protect workers at HHS who will speak out when they see that public health is not being put first. Dr. Disbrow, you're here instead of Dr. Rick Wright, who filed a complaint earlier this week detailing a shocking culture of corruption that prioritized cronyism over public health, including at an agency critical to vaccine development and distribution. You can expect a question from me on that, and I expect the truth from you. And while I appreciate the interest in this, quote, Shark Tank initiative to develop new tests, we have to remember that the fight against this virus is reality. It is not reality television. It has to be led by scientists, and it has to prioritize public health, not profits, not politics. And while innovation plays an important role in the development of vaccines and treatment and tests, there is no silver bullet. In fact, we've already innovated faster, high throughput tests, at-home collection tests, and point-of-care tests. And critically, there is much more in the pipeline. The problem is not lack of innovation, it is lack of national leadership and a plan from this White House. You can innovate the fastest car in the world, it still won't get you to where you're going without a good driver and good directions. And when it comes to testing, this administration has had no map and no one at the wheel. There is a reason they say failing to plan is planning to fail. And it absolutely applies here because the fastest, most innovative test is not much use if we don't know how many tests we need, if we don't have a supply chain with capacity to manufacture all the tests and supplies that we need, and if we don't have the workforce and lab capacity to actually use those tests and supplies. And even if we had enough tests and supplies and labs and workers, they can't have the necessary impact if they aren't distributed widely across the country, if they don't reach essential workers and underserved communities and tribes, people with disabilities, homebound seniors, communities of color, and high-risk populations. If tests don't become available to asymptomatic people, or if we don't enforce current law that requires free testing for everyone. And even addressing these issues won't be enough without plans to use testing results as effectively as possible to fight coronavirus, like rapidly recruiting, training, and sustaining the workforce we need for public health efforts like contact tracing and quarantine and isolation, and using data to surveil and track this disease within our communities while protecting privacy. Now, I was pleased the administration finally told Washington State last week it would be sending all states a significant number of supplies to help expand testing capacity. However, even if they finally deliver the supplies we have been asking for months, that is still not a plan. It's a piece of the puzzle. As long as the administration refuses to look at this full picture and develop a detailed national plan to rapidly ramp up testing, we are not going to make the progress we need to get people safely back to school, back to work, and to some sense of normal life on a national scale. Because our experts won't have the visibility into transmission they need to ensure public health drives our efforts to reopen. That is exactly why I fought to secure language in the latest COVID-19 package that Congress passed that requires the administration to submit a strategic testing plan no later than May 24th. I'm going to be watching closely to make sure their plan addresses all of the questions we desperately need answered. And I'm going to be pushing for more resources to build and sustain the testing efforts that we need, support contact tracing and other public health efforts, and to plan for vaccine production and distribution so that as soon as we have an effective vaccine, we can scale it up quickly and make it available and free for everyone. While the $25 billion we passed for testing recently was a good start, it is going to take a lot more to get this job done. Yes, it will take innovation, but it will also take some semblance of leadership from the president, because no matter how innovative our tests are, we cannot reopen our country safely until they are fast, free, and everywhere. And no matter how hard frontline workers and governors and families work to do their part, we still need the federal government and its president to step up and finally do its part. Thank you, Mr. Chairman. It's great to be with you this morning.